reliably see is decrease in inflammatory markers. We often see a decrease in triglyceride numbers and increase in HDL. We see LDL either go down, up, or stay the same. It's kind of one of those variable ones. We typically know that most of the data we have on nutrition is obtained through these types of studies in nutritional epidemiology, which are just notorious for being inaccurate. And so what we see and what you'll see clinically is there are people that will have very high levels of uric acid but never develop gout. And there are people that will have conversely kind of low levels of uric acid that will develop gout.
Hello, today's special guest is Dr. Shawn Baker. He is a board-certified orthopedic surgeon, an elite athlete who holds multiple world records, and a former nuclear weapons launch officer. He was actually the very first medical doctor that I discovered through YouTube who not only advocates the benefits of consuming red meat, but also lives his own message and leads by example. And I get that this might be a very controversial topic, but I hope everyone listening would have an open mind. And if there are still concerns or questions after the video, please feel free to reach out in the comments and message. Dr. Shawn Baker.
Okay, hello. Thanks for the chat. I appreciate it. Hopefully, I guess it's good to have more medical people that are learning about this and interested. So anyway, good to meet you.
So before we begin, could you give us like a brief background of who you are and what you do and how you even got into this diet?
Yeah, so I'm a 54-year-old orthopedic surgeon that has been a lifelong athlete. I found out kind of in my mid-40s, like early to mid-40s, that I was starting to develop signs of metabolic syndrome, and I wasn't happy with that. So even though I was training, extremely hard, still I just won a world championship in a sport called the Highland Games, where I throwing stuff. I was a big 285-pound, 6'5" guy, and very strong, but was certainly seeing some signs of ill health. And so I went through just a dietary journey, and I tried all different types of diets. I started out on a low-fat diet, high in fruits and vegetables and lean protein, and it did help me lose weight. I just felt miserable though. I mean, even though I got down and lost weight, but I was just hungry all the time, and I couldn't sustain that. And so I transitioned through various different versions of diets, and ultimately ended up on low carb and then ketogenic diets. And then about 5 years ago, I kind of started looking at this sort of meat-based diet and kind of ended up there. And so since that time, I've been on this carnivore diet, and I've kind of been a little bit of a lightning rod for this carnivore community. I've been kind of a figurehead, and have seen and helped literally thousands of people improve their health by using it. So that's kind of my background. I mean, I've been a world champion in a number of different sports. I still continue to compete today and still do very well,
I saw in your bio, you have a lot of world records. You're a world record holder, right?
Yeah, in different sports. Yeah. I mean, different kind of, some of them are kind of a little bit obscure. But Highland Games, powerlifting, Concept 2, some American records in track and field types, or all-American status in track and field, and different things I've tried. I'm hoping, my latest, I just started doing some martial arts, so I'm hoping to compete and hopefully win a world championship in that particular thing as well. So I'll just continue to keep pushing for it.
And you built this amazing community of carnivores with just all meat diet. So you must be getting like a lot of criticisms now with like vegan people saying.
Sure. Yeah. I mean, I do. And and that's fine. I mean, I think anything should be questioned, and I think it's fair. Some of it's not very useful. It's just, some of it's just silly, ad hominem type stuff. But, I think I have no problem with people questioning and criticizing, because it's a lot of stuff we don't know the answers to yet. And I think it's just, we're still learning. What I do know is that I'm seeing a lot of people get healthy, and that as a physician is, at the end of the day, what we should all be striving for. So, I mean, despite the criticisms, I'm seeing people that were sick that are no longer sick. And I think that's a good thing.
But that's the thing, like as medical students, like as I'm doing all these USMLE, as I'm sure you remember, USMLE like practice questions, were taught that a lot of the answers to these questions is to reduce the red meat intake. And that's like, the healthy option. But I think that really also stems from the concerns for uric acid.
I'm sure, like, because I sent you a list before. I don't know if you took a look at it,
I
but
did, yeah.
how would you respond to just uric acid buildup and gout?
Sure. Well, I mean, first of all, we can't, conflate high uric acid always with gout. I mean, they certainly run together, and there's an association. But what most people don't know, and I wasn't taught in medical school, uric acid is an antioxidant. In fact, it's one of the most ubiquitous antioxidants in our body. And there are relationships with elevated uric acid, which actually can be protective. Now, one of the hallmarks of gout are high levels of uric acid, but there's also the precipitation of the gout crystals, whether they end up in the skin or in the joints. Typically we hear classically, the big toe, and the reason it occurs in the big toe is because it's also dependent on temperature. So there are a lot of variables that affect whether or not uric acid crystallizes and actually becomes symptomatic gout. And so it's more than just, do you have high levels of uric acid due to either purine consumption or alcohol or fructose. And so what we see and what you'll see clinically is there are people that will have very high levels of uric acid, but never develop gout. And there are people that will have conversely kind of low levels of uric acid that will develop gout. What I see almost universally is those people that develop gout are also at risk for metabolic syndrome. In fact, it's very common. And so I think what's happening is if you have the underlying metabolic milieu, chronic inflammation, insulin resistance, so on and so forth, then gout is more likely to occur. Now, you can certainly fix those underlying factors, the inflammatory part, the metabolic syndrome part, by going to a meat-based diet. And even though your uric acid may go up, all those other factors reduce. Now, what I do see is during the transition period, and many people come to this diet and they're already metabolically ill. They're inflamed. They have flat out diabetes. And in that particular population, they are vulnerable because if the uric acid level goes up, they may precipitate a gout attack, particularly if they've already had gout. If they've already had gout, then they have all those factors in place. And some of those are, like I said, metabolic and immunologic. The immune system has a role in gout, gout precipitation as well, or uric acid precipitation. So what we see is during the transition period, some people that already have gout, they may have to be on their gout meds for a month or two until they lose the weight, until their glucose comes down, until their inflammation comes down. But it usually does fairly reliably. So gout in the chronic state is not an issue regardless of uric acid levels, at least in the population that I've
But would you recommend this carnivore diet for hyperuricemia? People with hyperuricemia with a lot of
I would not recommend it based on that. I think if they have a predisposition for gout associated with that, then they may have to continue taking either the allopurinol or the colchicine or the anti-inflammatories initially. But once they get through the transition period, generally we see it go away, which is kind of interesting. You'd think the opposite might occur, but that's just the paradigm that meat is causing metabolic disease when actually it's not. It's actually it's actually the standard American diet, which is, it's just a bunch of processed hyper refined grains, sugars, oils, and even proteins. And so when we go to a normal, natural sort of, whether it's whole foods diet, we see tremendous reductions in those things.
But what about the lack of fiber? Because fiber, as we learn in medical school, it's supposed to be a bulk forming laxative with the soluble fiber increasing the water absorption in the intestinal tract and stretching the bowel wall and stimulating the peristaltic movement and aiding in digestion. That's how we learn in medical school. So if you're limiting that amazing component to our nutrition, like, wouldn't that be detrimental to digestive system? I don't know.
Well, that's the theory, and in practice that doesn't hold up. In fact, there's a nice study out of several studies have come out, I think, looking at constipation and fiber consumption, and the study where the best outcome was when they completely eliminated fiber. They 100% got rid of symptoms. And so things like constipation, it's not a problem. It's, if you think of it as a traffic jam, adding more cars to the traffic jam is not going to help. So it's a primary problem with either gut mobility or peristalsis, the migratory motor complex. There's a whole bunch, as you learn in GI physiology, at least what I learned, this is 25 years ago when I learned this stuff, but it's probably still very similar to what they teach you. Fiber has there's a lot of associational data that shows People that eat fiber are more healthy. Again, this is the problem with nutrition, nutritional epidemiology. It doesn't account for confounding factors, the healthy user bias. We know that most of the data we have on nutrition is obtained through these types of studies, in nutritional epidemiology studies, which are just notorious for being inaccurate. These food frequency questionnaires where you ask somebody what they ate for the last 6 months and nobody really knows. The answers aren't really accurate. The relative risk numbers are very small. I mean, they're 20%, 30%, which is meaningless, quite honestly, when you look at what's actually truly allows you to infer causation. I can tell you that having seen literally hundreds upon hundreds of people with primary gut issues, whether it's ulcerative colitis or Crohn's disease, either there's inflammatory bowel diseases or irritable bowel syndrome or chronic constipation, going on a meat-based diet helps almost, with rare exception. And so despite what we may think, and we've not studied this, again, we don't have good studies on meat-based diets, where there's a few that are underway and, they're going to be coming out. But, the problem is we conflate the standard American diet, which is, red meat only makes up about 5 to 8% of the standard American diet. It's a very small component. The primary part of the standard American diet is hyper refined grains, sugars, seed oils, 50% is processed food. That's the issue. That's what's causing all these gut issues. That's not the red meat. But unfortunately, there's some conflicts of interest that kind of steer folks that way. And unfortunately, the nutritional advice is not really based in really good science.
Another concern that always comes up is vitamin C deficiency with just doing pure meat diet. How do you answer that?
Well, I mean, it's been known for well over 100 years. And this goes back to some of the people that were, doing some of the explorations of polar climates, that scurvy was not only prevented, but it was also treated by having access to fresh meat. So we know that there's something in meat, whether it's vitamin C or not, that prevents the development and reverses scurvy. Vitamin C is something that is, something that humans cannot really make. There's some, belief that when we lost our ability to synthesize vitamin C, we also at the same time saw a decrease in the uricase enzyme, which, as I mentioned, uric acid is an antioxidant. So what we may see that uric acid kind of picks up some of the slack for vitamin C. They both have an antioxidant capacity. We also know that glucose structurally is very similar to vitamin C, and they compete for co-transporters or transporters. And so across the cell membrane of the enteric, the gut cells, across mitochondrial membranes, across many membranes in the body, vitamin C and glucose compete with each other. So when glucose is in a relatively lower state, particularly through the gut, vitamin C absorption is higher. We also know that the critical role of carnitine, which vitamin C plays a significant role in. Carnitine has a role in fat oxidation. Carnitine is in abundant supply in red meat, so your carnitine intake is higher. So I think in a meat-based situation, you need less vitamin C, and also there is some vitamin C in meat. Now the USDA lists vitamin C as 0 in meat, but actually other independent labs have shown that a pound of meat has about 10 milligrams of vitamin C, and so some people believe that 10 milligrams is enough to prevent scurvy. Now, whether you're getting the optimal amount, I think some people, the RDA is something like 50, 60 milligrams a day, and some people recommend higher. That's debatable. And again, that may be context dependent. I think all these vitamin and mineral requirements are context dependent. It depends on, the assumption is everyone is eating basically the same diet. This is where these RDAs come from. Everybody's eating kind of a 50, 60% carbohydrate grain-based diet with, some fruits and vegetables, a little bit of meat, a little bit of dairy. And our RDAs are based on that. But when you don't do that, vitamin mineral requirements are likely altered. For case in point, the zinc requirement. We know that if you eat foods that are high in phytic acid, it interferes with the absorption of zinc. And these things would be like grains, beans, legumes. So you have to, for every gram of phytic acid you intake, you have to double your zinc intake. And so again, these numbers are not universal for all people. It's just that not many people do really low carb diets or meat-based diets, so they don't enter into the calculus of recommendations. But I mean, again, and this is the thing, it is what it is. I've seen literally tens of thousands of people now do this diet, and I've almost never seen anything that clinically looks like vitamin C deficiency. I've seen some people with low vitamin C levels, not very frequently at that, but they tend not to be symptomatic either. So it's kind of like even the serum numbers are not necessarily purely reflective of our status. It's something that we have to realize that the blood markers may or may not really indicate what's going on.
So with the blood markers, what do you usually see in the blood markers?
Well, what we reliably see is decrease in inflammatory markers. We often see a decrease in triglyceride numbers, an increase in HDL. We see LDL either go down, up, or stay the same. It's kind of one of those variable ones. We typically see those that have high glucose numbers normalize that. We have a lot of diabetics that come off their medications. We see we don't really see any real abnormal. Well, we do often see BUN up. We often see creatinine up, and that has to do with just protein status in the body. I mean, creatinine is a marker for protein, whole body protein, and whether it's extra muscle mass, exercise, or protein ingestion. And so that's one of those numbers you have to understand, that just because you have higher creatinine or higher BUN doesn't necessarily mean that's problematic in someone that's eating a lot of protein.
But there's nothing wrong with their kidneys if they I don't know, maybe have more than 1.2 in their creatinine and BUN.
Well, it could be, but you have to be able to put it into context. So I will tell you, we typically calculate the glomerular filtration rate. Remember, it's an estimated glomerular filtration rate. It's not an actual number. It's not a measured number. It's an estimate based on serum creatinine. That number, if someone is, small and actually in renal failure, that number will go up. The creatinine will go up in many cases, and that does indicate problems. But generally, we see a mild elevation in people eating a meat-based diet. But if you run another test, like a cystatin C, which is an alternate way to calculate GFR, it's often perfectly normal. In fact, mine, I've done literally on the same day, I've run a GFR on myself with creatinine. My creatinine is a little high because I'm a big muscular guy. It's going to normally be. That's why you'll see this African-American correction factor, because the assumption is African-Americans carry more muscle mass. That's why the numbers always skewed. But for me, I've got a glomerular filtration rate based on creatinine showing 66, which is relatively low, but it's 118 if I use cystatin C. And then I've also, I've checked for, microalbumin and nothing in there. So my renal function is fine, even though my serum creatinine is a little high, my BUN's a little high, my GFR based on those numbers is a little bit on the lower side. But again, this is something that you're not going to be taught in medical school, because creatinine is just a basic standard test everybody does. Nobody thinks about it. You're not going to have, outside of maybe some bodybuilders, you're not going to have a lot of people eating a really particularly high protein diet. And high protein, the U.S. diet is about 15% protein by macronutrient amount, whereas a meat-based diet is going to be about 30%. So you're going to double your protein. And I think that's probably more consistent with what we did evolutionarily, by the way. And we've seen more and more evidence showing that higher protein diets leads to better satiety, better body composition, better health in general. So
but I'm a little confused. You said that sometimes LDL levels even go down, because I'm pretty sure we learned that I don't know, it actually saturated fat would increase the LDLs, and I don't know how would you hypothesize that?
Well, I think, I don't know that we know all the reasons for that, but there does seem to be a genetic component to that. But yeah, I've definitely seen people with very low LDLs. I mean, not below 100, but I mean, certainly relatively low. I've seen some below 100 on this diet. It's unpredictable. I can't tell you the response. I've definitely seen people with high LDLs with the diet. I've seen people with, like, mine didn't change. I mean, mine has always been about the same, regardless of when I was doing this diet or not. And so it's just, I'd say probably 30% of the people see an increase. And we've seen a lot of, there's a lot of studies out there, particularly looking at ketogenic diets, and showing that LDL doesn't necessarily always go up. For some people it does, but not for everybody.
But should you be concerned if you see like a higher LDL levels all of a sudden on this diet?
I think you shouldn't ignore it. I think you should understand the overall risk profile. I mean, the typical concern with high LDL is cardiovascular risk, and so you need to understand that LDL is but one component of cardiovascular risk. And so if we look at the whole package, we look at, say, insulin status, insulin resistance, diabetes, inflammation, obesity, and then, things like smoking, which that's not really germane to this topic because it's always a bad issue to smoke regardless. But, like there's a recent analysis of women's health study looking at risk factors for cardiovascular disease. The number one issue was diabetes. And then from a lab standpoint, the LPIR score, lipoprotein insulin resistance score, had about an 800%, or an odds ratio of 8, whereas LDL cholesterol was like 1.3. So, I mean, there's things that are more important, and depending on the age of the patient, what's going on. If you get somebody who is previously obese and diabetic, and you put them on say, a meat-based diet, and their diabetes goes away, and their obesity goes away, and their blood pressure normalizes, their systemic inflammation goes down, but their LDL goes up, you're like, is that really a problem here? You can't just look at LDL in isolation. And I think most people, that even lipidologists saying that the standard lipid panel with just LDL is, it's not particularly that, the ultimate thing we should be looking at. We might want to look at particle size, small dense particles versus, large, less dense particles. We want to look at, triglyceride numbers, HDL numbers. You might want to look at whether the particles are oxidized or not. So it's more than just what's your LDL. There's more nuance. It's a red flag. You should certainly further investigate it. A good physician will start to say, hey, your LDL is high. And the answer shouldn't be, let's put you on a statin and go on a low-fat diet. It should be, let's investigate further and see if these other things are a problem. And to be fair, we're still getting studies done that are sort of showing us the way that, maybe not the only marker, ApoB and some of these other particles, lipoprotein a, all these things may have more relevant effect than just a standard LDL. So it's a blunt screening tool. It's like BMI. My BMI is 30, but I'm not obese, right? So I mean, it's like, hey, it's a screening tool. Then you just look at the patient. You just can't look at somebody's labs. Somebody gives you a sheet of labs and doesn't tell you, and you never get to examine or see the patient. You're doing the patient a disservice.
Yeah, you're not supposed to treat the lab. You're supposed to treat the patient, right?
Right. Exactly right. Yeah.
So how long does it usually take? Do you usually clinically see like an improvement in this diet? Does it take like weeks, months, or years?
Yeah, a little bit depends on the person, where they come from, where they're starting at. I mean, I've seen improvements within several days with things like somebody who's an insulin-dependent type 2 diabetic. We may have to cut their insulin at half on day one. I mean, there's very dramatic improvements that can occur very rapidly. Some people see significant improvements in inflammation, joint pain will go away, or things like that. Gut health will improve. People suffering with chronic digestive issues. But what I've seen, I've got data on about 10,000 people that have done this. We did just a large survey, and it seems to be about the 3-month point was a pretty big inflection point. And we saw, just people that were, either doing okay or doing good shift up into doing excellent to doing good at the 3-month point. And that seems to be a kind of a transition period, for most people have kind of fully transitioned through by then.
So who are the people that are seeing the most amount of improvement from your experience?
Well, I mean, I think the people that are seeing the most improvement are the people that tend to be doing the worst, the sicker people. But I think, unique to this diet are the kind of autoimmune inflammatory conditions, which seem to respond to this diet more so than any other diet. I mean, there's lots of ways to lose weight. There's lots of ways to improve your blood pressure or your diabetes. Most diets will do that, just getting rid of the junk out of the diet. But what I've seen the most excitement is from people suffering from autoimmunes, whether it's Crohn's, psoriasis, rheumatoid arthritis, some of the mental health conditions, anxiety, depression, bipolar disorder, even PTSD. These are the things that the average diet doesn't seem to be as effective at, and this diet uniquely seems to be more beneficial for. So that's something that is, I think, if your patient comes in with Crohn's disease or an autoimmune disease, the first thing I would do is put them on a pretty solid elimination diet, like a carnivore diet. And, before I'd start throwing the corticosteroids and, immune modulating drugs at them, I would say, let's really look at diet first. You want to include a lifestyle with that, getting enough sleep, doing exercise, getting out, get some sun exposure, all those typical things that you're not going to get much, you're not going to get much exposure to in medical school. It's something that's kind of intuitively obvious, but we don't know how to do it. We don't have the support system. That's the problem. One of the problems you get into is even if you want to do it, you're not supported.
So what about for people kind of like me, like I'm just a normal person. I don't have any autoimmune disorders, no problem with obesity or anything, any pathological disorders. How would you, I don't know, recommend this diet to me? Like, could I don't know, have a beer here and there or a wine? I enjoy my steak with a good red wine. So like, is that a problem in this carnivore diet, or should I completely eliminate alcohol?
Well, the one interesting thing about saturated fat and alcohol is there's both animals and human studies showing that saturated fat mitigates the damaging effect of ethanol on the liver, which is kind of interesting. So I'm not that I'm encouraging people to go drink a bunch when they eat steak, but it's kind of an interesting sort of phenomenon. So, I think for the average person, I think for somebody who's very, very sick and very sensitive to different foods, being strict for a significant period of time is very important. For the average person who just wants to maybe tune up their health a little bit or feel better or perform better, I think, a diet that is based around, meat, particularly even red meat, and not including junk food in there is a very healthy way to go. And so if it's an occasional, glass of wine or an occasional indulgence, you're probably fine. Your body will let you know. There's something that, we still have the capability to tell when we feel good and when we don't. We don't need an MRI or a, fancy lab panel to tell us that we're feeling okay. So, and I would say that probably 90% of the people that do this particular diet, in the end, stay somewhere in this 90 to 95% range. They may be, mostly, carnivore, and then they'll have, a piece of fruit here and there, or once in a while they'll have something of that. And that's mostly, for most people, it's fine. What we do have is a lot of people that are struggling psychologically with food addictions and things like that. And for those folks, it can be hard to kind of to walk the fence a little bit. So they've got to be a little more tightened up. For many people, can you have a piece of cake once in a while? Yeah, if it's once in a while, probably fine. You may or may not feel that good afterwards, but at least if you're cognizant to that, and if you start doing that for a bunch of your meals, it's a nice baseline. You'll know, like, hey, I feel really good on this diet, and then when I stray too far, I don't feel as good. I don't have the energy. I'm tired. I've got aches and pains. You're young enough where you probably
Yeah, I'm at 26 years old. Yeah.
But as you get into your 30s, 40s, 50s, you got more sort of reminders of when you screw up. Mm-hmm. And it's like, if you go off, I get a lot of people, they'll go off the wagon for a weekend, and they'll like that. I feel like I'm hungover. I just feel like I got in a fight because everything hurts. So yeah. But yeah, I think if you're, and like I said, I don't want to give the impression I think everybody should be on the diet or it's the only diet that can work. I do want to say that meat is not the bad guy. It's not. Meat is a food that we have literally evolved with, and is one of the reasons we're human beings is because our adoption of meat-based diets and heavily meat-based diets. In fact, the recent anthropology literature indicates that for about 2 million years, humans were very close to being very strictly carnivorous, or very mostly carnivorous. So I think that's our sort of.
And you don't need any supplements for this, right?
You typically don't. Some people will find that electrolytes seem to help, but other than that, I don't. Most people don't. Some people, if they've come with a known nutritional deficiency state, they might need to either supplement or tailor the diet to hit more of these things. So you can include more organ meats, you can include seafood, and you can include dairy, and you can literally make an RDA complete diet out of this if you want to. I don't know that you have to. And I think once, like if you got somebody coming from, say, a plant-based diet, they may be more, or just a pure junk food diet, they may be more nutritionally depleted. Play the detective, and it's tough as a physician. You're going to get 10 minutes to see a patient, so you don't have time to do a entire food history with people, and the dietitians don't typically do that.
What do you usually see in people that are starting this diet in like the prodromal phase, like the beginning stage of this diet? Is there like gastrointestinal distress? Or like...
there can be. Some people will have, whether it's either, infrequent bowel movements, which are not the same as constipation. They're just not making as much waste. Remember, meat is well absorbed in the small intestine, so you don't have much food in there or waste material, with transported across the colon. Some people will develop a diarrhea for a period of time, just due to, I think one of the, I'm sure as you learned or haven't, if you learned that one of the functions of the colon is to reabsorb fluid and electrolytes. And when we go on a meat-based diet, we don't have any sort of fiber in transit. So fiber tends to hold on to water. So you're exposed to more water or more liquid. And so the colon may not be adapted to handling that. So that takes a little while. Some people, the biggest thing I see is people may often undereat because it's so satiating. So they may have energy issues because they haven't eaten enough. Those are the biggest things. Yeah, I mean, it's something that I think, 3, 4, maybe 8 weeks, maybe 2 months to fully transition for most people. June, unfortunately, I gotta run, man. I gotta go.
Okay, all right, thank you so much. Okay, it was an absolute pleasure. Thank you.
Yeah, good luck, and let me know how it goes. Okay, if you want to do this again sometime, let me. We can try that.
Absolutely.
Okay.